Welcome. My name is Joan Henneberry, and I am the Executive Director of the Department of Healthcare Policy and Financing. And I'm very happy to be here this morning to help us launch this Own Our Future campaign. I want to welcome all of you and thank you for joining us. This campaign is targeted at Coloradans aged 45 to 65, and I'll confess I'm right in the middle of that group. And it's to help us think about how to start planning for our future and our long-term health care needs. You know, we're all responsible in large part for our health and for owning our future. There's a lot we can do to prepare and to be ready for that future, both our health future and our financial future as well. And we do that all in our own way. Personally, I'm a hiker and a trekker, and that's how I try and own my own health future to stay healthy. There you go. I don't wear these shoes with my suit all the time. And one of the things I like about walking, first of all, how could you not want to walk around in this beautiful state of Colorado? Walking is free, yes. Very important in today's economic times. Almost all of us can do it, even if we need a buddy to walk with. And we can do it when we have only short periods of time. We can do it when we have an hour or an afternoon, but we can do it when we only have 15 minutes to spare. So we can always find time to take a walk and to get out there and to do things that help make us healthy, as long as you have a good pair of shoes. So in order to reach our goals, we do need to take better care of ourselves, make healthy decisions, and plan for our futures. Again, both for our health care as well as our economic care. And long-term care planning is a really essential part of that process. And that's what we're here to talk about today. And I can't mention all the staff and all the agencies that have been, and our private sector partners who've been working really hard on this for over 2 years now. But you'll see them after we finish the press conference, and I really want you to be sure and take some time to talk to them. You know, the statistics here are pretty staggering. An estimated number of 70% of the people over age 65, that's more than 9 million Americans right now, will require some type of long-term care services in our lifetime. And more than 40% of those people will need nursing home care at some point in their lives. Long-term care services are expensive, and they're not typically covered by private insurance or disability insurance. So for example, the average cost to live in a Denver area nursing home in a semi-private room for 1 year in Colorado is over $66,000 per year. For Colorado nursing home residents who are there for 5 years or more, the cost can easily exceed $300,000 for that individual and their family. So it's easy to see why the cost of those services can quickly lead to a financial crisis for those individuals and their families. So the good news is, over the last 2 years, we have been taking a number of steps in preparing to ensure that health care is more affordable and accessible to our residents, including long-term health care. It's a key component to our health reform discussions and Governor Ritter's plans to make health care more affordable and accessible to everyone in Colorado.